This is a PowerPoint presentation to inform you about the period of delivery and the first week with your baby. The presentation is provided by Preal. Preal is the name that binds all the professionals in birth care in Almere and Lelystad. Preal also stands for We work together around, but most of all with you. The weeks between your 37th and 42nd week is the normal period to deliver. From 31 weeks on, we like to decide together with you if you would like to wait or prefer to be induced. Delivery most of the time starts by getting contractions. In this period of your pregnancy, it is okay to wait until your contractions come frequently, every 3 to 5 minutes, and each contraction lasts about a minute. Contact your midwife or hospital if this lasts for an hour or more. If you have worries about what you feel or got specific instructions to call earlier, contact them before the hour is done. Delivery sometimes starts by the breaking of the membranes. We like you to check the color of the water. If it's clear, white or pink, you may wait for the contractions and contact your midwife or hospital at daytime to get further instructions. If the color is brown, green or yellow, the baby probably pooped in the water. This can be a sign of distress. Therefore, it is wise to contact your midwife or hospital immediately. We would like you to deliver as soon as possible with continuous registration of your baby's condition. If delivery started or you really doubt it, you can contact your midwife or hospital, day or night, by calling the emergency number they have given you. If you get your care through one of our midwifery practices, they will come to visit you once delivery started. Here you see some drawings to show you how the process of ripening and dilatation of the cervix works. Your cervix needs to become soft and thin before it opens up. Because this process also takes time, the dilatation might take more time than you expect in the first part of delivery. From 5 centimeters on, it might speed up. The whole process normally takes about 12 to 24 hours. If you have a choice of home delivery, it is wise to make your final decision by the time you reached 4 to 5 centimeters dilatation. This also will be the moment for the midwife to call for kraamzorg to come to assist her. By the time you reach the 32nd week, we advise you to pack a bag with clothes for you and your baby, some sanitary things like toothbrush, and also set on a maxi cozy to take your baby home. You will need this in case you would like or need to go to the hospital. It is wise to think over who you would like to have with you to support you through labor. Often this will be your partner, but it could also be your mom, another family member, or a friend. Whoever it will be, they will be there for you, not the other way around. Ask your midwife or doctor about possible corona restrictions concerning the amount of people. Maybe you are having hospital care for medical reasons. This could be, for instance, if you had or will have a cesarean section, if your baby is in breech position, if you are having diabetes or being ill, maybe you are expecting twins or having hypertension, or your baby is big or small for gestational age. At last, It is also possible you are having any other disease that might complicate your pregnancy. At daytime, you enter the hospital through the head entrance. At nighttime, this one is closed. Then you need to use the emergency entrance at the left side of the hospital. In the Flevoziekenhuis, we train doctors and nurses. All trainees will be supervised by more experienced professionals. The delivery ward has several delivery rooms, all of them with your own toilet and shower. Only one of them has a bathtub. A virtual tour to show the rooms is available. If you choose to have medical painkillers during delivery, you will always need to be in hospital. Flevoziekenhuis has two kinds of painkillers available, remifentanil and epidural. Good thing about remifentanil is that it works fast, the pain you experience gets less, and you are the one to dose it by pushing the button. Less ideal can be the fact that continuous monitoring of mother and child is necessary, because it might give you more difficulty breathing, and the morphine will also reach the baby through your blood. Besides that, you always need to stay in the bed. Good thing about epidural is that if it works well, you will have none or little pain. The painkiller has no influence on the baby and you will stay alert. Less ideal can be the fact that it takes more preparation to provide. Sometimes it doesn't work as well as we hope. You also could get low blood pressure and will need a urine catheter. Sometimes you get a fever. If so, we might advise to start antibiotics to prevent infection of mother and child. Sometimes there is a reason to induce delivery. Not always your body is already up to that. If necessary, priming will be given first. Most used methods at the Flevoziekenhuis are balloon priming and priming by prostaglandin tablets. Prostaglandin gel we hardly never use anymore. Priming might take several days. You are submitted to our ward. Your partner can visit at daytime, but is not allowed to stay. Your doctor will tell you more about the procedure if necessary. Once your cervix is ripe enough, you will be admitted at the delivery room. There your partner can be with you at all times. We will start by giving you an infusion to provide IV medicine for contractions, and we will break the water. During the induction, monitoring of the baby is necessary to check the baby's condition and reaction on medicine. And then, finally, you will meet your baby. If all is well, you will be able to leave the hospital 2 to 4 hours after finishing delivery. But sometimes we would like you to stay. For instance, if the baby pooped in the water, if your baby needs extra treatment, if you had a cesarean section, if your baby was born by vacuum, but also certain reasons to induce or fever could be a reason to stay a while. If your baby is born in our hospital, you always need to subscribe to your baby in Almere, even if you don't live here. Subscription is possible online at www.almere.nl. You need to subscribe within 3 working days. Our ward will provide you a document to upload. If you cannot find your way down there, tell us and we will help you out. If you need to stay, you will have your own maternity suite for the first 3 days. In this room, your partner can stay with you and your baby. Other children can visit, but are not allowed to stay the night. In the suite, breakfast will be provided for you and your partner. Other meals during the day will only be provided for you. Here you find our visiting hours. If your baby needs the care of a pediatrician, we will try to use family-centered care. This means we will try to keep your baby as close to you as possible when it's in need for extra treatment. For instance, if there is need for IV medication, we look for the possibility to give this while your baby is staying at your suite. If your baby is admitted at the neonatal ward, we look for the possibility for you to be admitted there too. When you and your baby leave our hospital, we want you to use the baby chair to take your baby home safe. In the first week after delivery, you will be checked frequently. If you are at home, your midwife will be the person to call if you have worries. Reason to call them might be if you lose more blood than your bandage can handle for 3 hours. If you have a fever, very painless breast or legs that are red, swallow and painful, or when you are emotionally disturbed. For your baby, you have reason to call them if the baby has high or low temperature, if it's hard to wake up, throws up extremely, or whenever you worry about the color. If you and your baby are at home during the first 8 days, there will be a nurse, also called kraamzorg, who will come to your place to help you out, teach you how to handle the care of your baby, and check the both of you. You need to take care of the subscription to kraamzorg yourself. In order to take care of the nurse's health, we ask you to level up your bed. Ask your midwife or doctor how to provide this. In the first week after delivery, you will be contacted by a nurse of the Youth Healthcare Center. She will come to visit you to take some blood from your baby's heel. This blood is checked for several diseases. She also will test your baby's hearing. When the baby is born, you will start feeding. This can be by breast or by bottle. This is up to you. We will teach you and help you how to handle the feeding. We have extra information for you about breastfeeding. If it's not provided to you already, please ask for it. We also provide a lot of information through Zwap. Unfortunately, it is all in Dutch. If you have someone who can translate it for you, it is a good app to use.